Welcome back. We've been joined now by an advocate of sexual and reproductive health and rights. She is Anita Irene. She joins us now to do justice to this issue. Welcome to the program. How are you doing?
Thank you so much for having me. I'm glad to be here.
Thank you so much. So you're in the space already. So let's start with something basic and brief. How does sexual health education or reproductive rights, how is it realistically when you go to educate or impart knowledge on people? What does that entail?
Okay, when you go to schools, especially because school is the most reliable platform to go to meet young people, because they are from kindergarten up until secondary school, they spend majority of their lifetimes there. Some of them they don't have these curriculums in their school. So when you're coming to them to talk to them about this, they're like, okay, what are you talking about? Because it's not there. As you said earlier, it's not enough to know biology, because it's more than just teaching the reproductive organs during biology classes. They do not have ideas. When you go to communities, like, they don't know what you're talking about. First of all, language is already a barrier. Then you're talking about something that is very culturally sensitive. If it's not culturally sensitive in that environment, then it's religiously sensitive in that environment, because in the culture in Africa, let me not just say Nigeria, in Africa in general, talking about such things expressively is mostly shied upon because it's something shameful. When you're talking about menstrual health, up until today, there are still adults, female adults, that are shamed when they're stained, and it's not their fault. It's something that is monthly. It's not like it's not an option for you. It's you have to.
You can't skip it.
You can't skip it unless you're pregnant. So you can't skip it. It's something they find very shameful, which it's not supposed to be shameful. Once you're menstruating, you should know that your organs are working very well. It's kind of like a cleansing. Take it like that monthly cleansing that your body has to go through. So going into communities, going into schools, there is no provision for such basic, comprehensive education to these people. So when you're going to them, there's already that language barrier, as I said, that cultural barrier and that religious barrier. And some of them don't even think that it's something that they should know.
So maybe you should break it down for us now. Why is it important for teens, for young persons in schools, these children, so to speak, to know about their sexual health and reproductive health and rights?
First of all, it's good they understand their body, not just the female now, male as well. Because male, when they are coming of age, there are also changes that their body goes through as well. It's good to, first of all, understand your body and how it works, because everybody are individualistic. What you're going through is first, like, for example, now, women are different. Some do not even experience menstrual pain. For people like me that experience extreme menstrual pain, like the kind of menstrual pain that they have to take you to the hospital and put you on that drip, you need to understand how your body works, so that by the time that it happens, you don't think that, oh, there's something wrong with you. It also makes you aware the kind of sexual practices that you should engage in, what kind of contraceptives that you should use. It makes you aware of a lot of things. How to manage yourself. Okay, probably a girl that, has not probably started menstruating. Okay, you know that, okay, between this age, I should start menstruating, so that by the time it comes, she knows that, oh, this is what is happening. For a guy, by the time he comes of age and he has wet dreams, because guys have wet dreams as well, once it reaches that age, they know that, okay, this is what is happening. They are not scared. They are not, like, funny story. One school that we went to in Tutuwada one time like that, the girl said she thought she was dying the first time she had her cycle, because nobody had told her that, okay, when you get to this age, you are to expect this. It also helped in preventing sexually transmitted infections and diseases like HIV, AIDS, and etc. You are guarded, you are protected by the wealth of knowledge that you have, so that when you meet those blocks, you will know how to, navigate your way through it.
Yes. Thank you very, very much. I was about to talk about how we have these gatekeepers who most times not let you, say as expressively as you want to on sexual educations when you go to their communities. So I'd like to ask you, at what stage in these schools do you think it is appropriate to talk about sexual health? Like you said, you went to a school in Tudunwada. So what particular class did the principals or the proprietors let you start to talk about these things?
For me, you should start very early. I could say 6, but earlier than that. Why am I saying this now? Back to some of the work that we've done with Fight Against Rape Initiative. We had a case whereby a 5-year-old was raped. Very sad story. So as early as a child can understand themselves, you need to start taking the basics. Okay, this is my breast, this is my ass, you need to let them understand that, okay, this is how your body works. And you need to let them understand that, okay, as you're growing up, it's going to develop, you're going to see changes. So as I could say 3 years old, because as a 3-year-old, so they're already getting to know certain things about themselves. So as they progress in life, as early as you can, sink it into them, turn it into songs, into rhymes for them to understand that, okay, this is male part, this is female part. Nobody is supposed to touch you inappropriately. Nobody is supposed to, no auntie or uncle for any reason. So the earlier, the better, because the rate at which children are, engaging in harmful practices sexually, it's quite alarming. And they really need to be properly educated so that we can put a stop to that. It's never too late. We just need more hands, to embark on this journey.
Okay. You mentioned what your initiative does, Fight Against Rape. So has there ever been a story or a particular experience you people have had when you went out to, propagate this gospel of early sexual education? Has there been a situation where somebody says, you know what, I don't want my child to participate in this. No, I don't want my peoples to hear this particular message you're bringing?
So far, we've not had such cases. So far, people have been receptive about it because I think we are growing. Civilization is almost everywhere. Civilization does not necessarily have to mean something negative. The way people know, first of all, when you are going to communities, you have to meet the community elders, which are usually men. We go to their palaces. Hello, we greet them, pay the necessary homage, and then we let them understand that this thing that we are coming to teach them is beneficial, not just to the women in their community, but also the men as well. We first of all gain the elders' trust, the people that govern them over there. We gain their trust to let them know it is not easy, to be frank, because you are going for first visit, second visit, third visit, fourth visit before they'll find like, okay, you've disturbed us enough. Oh yeah, come and do what you want to do.
Yes.
Do you get? Because you have to be persistent. You have to be constant. You have to be persistent so that you get this message across. And when you get there, you'll be surprised the stories that you hear. Because at the end of the day, once we do like that, we share pads. Okay, for those that cannot afford pads, what is the substitute? Reusable pads. And there are so many organizations this day, like SafePad, for example, Alora, for example, they are creating hygienic reusable pads with, a lot of ingredients in this pads that make it conducive, because that place is very, very sensitive. It's very sensitive. So to prevent irritation, to prevent fungus and other things from growing there, they are making it very, very safe. They are using technology that even if you do not have access to water, clean water, according to what they said, you can still wash it and it will retain that height. Because a lot of people frown on it, like, how can I reuse pads?
Again.
But it's even a safer option than what some of them are already using. Some of them are using rags.
Yes.
Some of them are using leaves.
Like,
how can leaf absorb, what comes?
Yeah.
It doesn't make sense. So that is a safer option for them to, use. So far, it's been so good. Yes, a little bit of, don't come with this thing again, but they've been receptive. They've been very receptive.
Okay, so it's a global issue, although some of the stats we brought up show how sub-Saharan Africa can have is predominantly affected when it leads to unwanted pregnancies or early marriages and all of that. So my question, you've already mentioned the issue with some funny ideas about pads. What other misconceptions do you think sexual health education helps to dispel? Maybe some basic things that people are thinking that is dangerous that they might not be aware of.
Okay, number one, once you've reached that age, they said if a man touches you, you'll get pregnant. And it's not possible. That's a very, very big misconception. There's a lot of processes and stages before that happens. Then if, for me, for example, if you experience very painful menstruations, you cannot get pregnant. That is not true. If anything, my mom had very painful menstruations that also led her being hospitalized as well. And then she has 4 of us. So that is a very big misconception that people, or rather ladies that have serious period cramps, have are not able to get pregnant is a serious misconception. And then contraceptives is a woman issue. Men do not care. Please, it takes two to tango.
Exactly.
So you have to educate the boy child, you have to educate the girl child that, okay, there is contraceptives for girls and there's also contraceptive for guys as well. So the both of you, if you want to engage in such activities, you need to come together to agree to use the safe practice so that it avoids early pregnancy, it avoids sexually transmitted disease. But the best way to go about this is just to abstain till you're fully mature, not just physically, but emotionally and mentally as well to, engage in such activities.
Yeah, exactly.
Fair enough. So moving on, we were also talking about the cultural barriers that might hinder, referring to Africa now. How do you, or what is your counter to some of these things? For instance, I think if we took a poll of, perhaps just some of us here, maybe just in this building, about how many of us got this education from our parents or thereabouts, not a lot of people might, because it's, again, like you said, it's seen as shy. So what's the response to that, particularly to the people that ought to be doing this? There are teachers as well who should be responsible, parents, basically anybody who's in charge of children in some way or form. What's the message to them so that they don't, that old ideology of we shouldn't talk about these things, find out on your own?
First of all, I need to start with parents because just as you said, majority of us, but let me say all of us here did not get that education while growing up. We had to learn on the way, and it's very dangerous if you're learning on the way because you're exposed to harmful things that you should not be exposed from. Parents should, they should throw away that cultural this and that, oh no, children are not supposed to know about this. You are leaving room for manipulators. You are leaving room for perverts to teach your children harmful practices, harmful sexual practices. So parents, please, I know sometimes it can be, a very uncomfortable topic, but if you look at the repercussion of it, it's better you sit down, have that uncomfortable conversation with your child as early as possible. Let them understand so that probably if an uncle or auntie touches them inappropriately, they can come to you. They can always come to you and tell you, say, Mommy, Daddy, guess what? That uncle touched me this way. Are they supposed to touch me that way? But you said they're not supposed to touch. That is wrong. You've created a safe space for them to be comfortable enough to come and meet you and have such conversations with you. Now, in the school setting right now, teachers need to educate themselves constantly. I don't know, there should be an ongoing yearly training, maybe once or twice a year, however they want it. There should be a training, letting teachers know that this is something that is mandatory. Because there are so much perpetrators these days in the society that if you do not take, because if you look at the school system right now, a parent will drop off a child in the school from 7 a.m. Some schools close by 2 p.m. Others 4 p.m.
Yeah.
So you find out that the child is staying with you longer than they're even staying with the parents. And sometimes the parents are not active in the child's life, which of course is also something that we'll tackle another day, which is very wrong because you need to be actively engaged in your child's life in order to create that safe space for them. So for you now, as a good education practitioner, the child is with you for most of their lives. Look at the time from 7 to 4 p.m. because there's still extra lesson again that they need to attend. Engage in resources. Equip yourself to answer difficult questions. Make your class a safe space for children to have these conversations with you. Oh, this person is touching you like this. It's not right. It's inappropriate. Let them know that, okay, certain touch are good touch and certain touch are bad touch.
Exactly.
So that if somebody out there touches them inappropriately, because teachers as well do touch students inappropriately, but if somebody outside touches them like that, they can come to you and then tell you, let us remove this shyness, because majority of us didn't get that growing up. Even the teachers as well didn't get that growing up. So why don't you be that advocate of change for these children? Let them be comfortable with you, because sorry to say, these days, I don't know, not to, overshadow the work that some actual good teachers are out there doing. A lot of teachers are very, what's the word I want to use? Like condemning. Do you get? and they are very judgmental. If you're judgmental towards the child you're supposed to teach, they're not going to be comfortable with you to tell you what needs to be said. And they are suffering in silence. As a teacher, and also as a parent, first of all, know that signs. If a child is very, bubbly and etc., and all of a sudden they are very quiet, try and understand trauma signs in a child.
Yeah.
And it's very difficult, especially when a child is quiet. A child is a known introvert. A child is very quiet. It's more difficult. But as far as you've made a decision to equip yourself with the right resources, you would definitely be able to point that out, because they don't talk. Quiet children don't talk. First of all, they are withdrawn to themselves. Then they go through something. They are even more withdrawn to themselves. You need to be patient. You need to be kind. Let kindness come out of you. Exude kindness so that they will see you that, we can talk to this person. This person is most times children are afraid to talk to adults because they feel like, it's going to be shared. Be a safe space. It's not everything a child. Be that a child's confidence so that they can be able to talk to you.
Yes,
So I would like to ask you, mentioned a lot of very beautiful things. Parents, teachers should, try to work along together to ensure that this child that is placed in both of their hands succeed in life as regards sexual education. So I would like to say, what are some very practical ways that these parents and teachers can come together to ensure this thing takes place?
Okay. First of all, we have the PTA meetings that they go for. I think first of all, is the teachers that is going to take initiative, because they are the one that spend, as I said, they spend more time with these children. They should let the parents know that, okay, we want to do this with your children. Why? Because it's going to help prevent a lot of teenage pregnancies. It's going to help prevent a lot of sexually transmitted infections and diseases. It's going to make them aware of how their body works. We're not teaching them this thing so that they will go and use it in a harmful way. This is the school. This is education. It's also part of education as well. So we're educating them on how to, look out for these signs, on how to understand themselves better. Because some parents could be like, oh no, don't teach what are you talking about? Why are you teaching my child? No, they need to understand this thing. And it can be done through parent-teachers conferences.
Exactly.
Then take home assignments for the parents as well. The teachers can go ahead and like, okay, we've done our part during the school hours. You do your part after school hours. Engage with your children. Have conversations with your children. Do not think that, do not wait till that child is, or let's say it's even 18 years in Nigeria is still considered a child.
Yes.
Because of the cultural norm. So do not say you are waiting till, maybe the child is 20 something, or maybe the child is ready to, about to get married before you start having such conversation. You'll be surprised what that child knows. You'll be surprised what they've learned, because these days, internet is there for them to learn.
Exactly.
Why don't you control their learning by being that safe space for them than them going to learn, things online, things from peer pressures, from their peers as well. And children learn things from each other. So schools, teachers should create clubs, and they should make it that, okay, in this club, this is what we are going to talk about. We are going to educate ourselves about this kind of thing, so that they are not they're not exposed to the worldly things, the harmful worldly things. Rather, it's controlled. Yes, you have this information. Yes, you understand these processes, but wait till the right time till you implement some of these things.
Exactly.
Indeed. So I guess my question now will be more to the formal aspects of things. I think as far as a lot of schools go, especially in sub-Saharan Africa, it's expected that sex education is just that particular biology class where they are talking about reproductive system. That is the extent of it. So are there examples you can give or recommendations about how this can be? Because the core of the conversation today is how can this become perhaps even something that is part of the curricula, not just something that, for instance, I mean, you're doing a great job going to places and educating people, but what happens when you are not there? Is there a system in place that, it should continue to self-propagating in a manner of speaking? For instance, there was a study the other day that showed that while I think about 80% of teachers believe that SHRR is important, only about 30% actually have confidence that they know enough or they are well equipped enough to teach it. So those are my two questions now. Who trains these people? And then after the training, what is the sustainable way this continues such that we know that everybody is going to go through this. It's not just one biology class that is
No.
reproductive system and then it's gone. Something constant, something sustainable that goes on and on.
First of all, the government needs to, rather, the Ministry of Education needs to integrate it into the school curriculum. We really need to revamp.
So would it be a subject on its own, or how would that go?
Yes, it should be a subject on its own because it's very extensive. There are so many parts of it that you need to dissect, and you cannot do that in just one class. Like I can't remember. Like I think it was in one sitting they did biology, that's reproductive system,
health,
and the majority of it I've already forgotten about it. So it needs to be a subject on its own. First of all, in the curriculum, and then of course everybody, whether you are teaching maths or you're teaching English or you are teaching social studies, you need to be equipped with such information, such resources. And how can they help? Apart from, first of all, integrating it into the school curriculum, you need to have like teacher trainings on this. And as I said, let it not be like a one-off something. It can be twice a year, it can be 3 times a year, it can be 4 times a year, because it's necessary to keep on, because new information, new research is happening all the time. So you need to constantly educate yourselves about this. And then the government should also provide funding for resources for these teachers. Okay, we've had the training, we are going back to the school. So what are we now doing? How are we teaching our children this thing? They need resources to teach the children about it. They need some practical examples to show these children about it. They need, sick bays, not just like the normal sick bays when you go for a headache or anything.
Decks or something like that.
Yes, a gender decks where you go to. They need to put pads inside toiletries, inside the toilets rather, for girls when they start, developing. Now, when you have all of this in place, it's a long journey. It's a long journey, but once you start that journey, and then let teachers please change that mindset of us that, oh, it's sexual. What are they talking about? It's sexual. Let's shy away from that. Because sometimes some of these teachers, especially in secondary schools, are old timers. So we really need to start with our government schools. We really need to start with them. We really need to let them know that, okay, this thing is not bad. This is education. Yes, understandably, you did not get this information, but the rate at which certain things are rising right now was not as how it was then. So it's very needful for us to educate ourselves with this things. It's very needful for us to have the resources to educate ourselves and then take it to the children, especially in public schools. In private schools, they might have it because it's a private school, they are paying school fees. So they have, to a very large extent, they have the resources to do that if they want to. But what about the public schools that do not have that resources? Government needs to provide this for them. They need to integrate it into the curriculum. They need to provide training specifically on this in every state, in every school in the nation. And they need to make it like a continual something because so that it doesn't become redundant. You learn today, you've forgotten about, so that as new people are coming into the system, new teachers are coming into the system, they are aware of it as well, and they are passing on the mantle. And then it's a continual cycle, and it's sustainable. It's not hard.
Thank you so much, Anita. You've really broken it down and enlightened us today. We hope that on your journey, you get more positive responses, and there will be always partners there to help and continue the work. Thank you so much.
Thank you so much.